Thank you, Deputy Presiding Officer. I would like to thank my colleague Jackie Bailey for bringing this important issue to the Chamber today. Long COVID is not simply a long recovery time for COVID-19, nor it is an occasional feeling of fatigue or sickness following a COVID-19 infection. This is a common misunderstanding. Long COVID is a complex, multi-system neuroimmune illness that currently has no known cure. A recent ONS survey showed that an estimated 2.3 million people in the UK suffer from long COVID. And a recent BBC Panorama documentary estimated that nearly 10,000 NHS workers are currently absent because of long COVID. One of my constituents, Marie-Claire, is an NHS doctor in Edinburgh. Marie-Claire has told me that the overwhelming response from the colleagues was that they often had little understanding of the severity of the illness. Marie-Claire also suffers from long COVID. There is a growing stigma about long COVID within the medical community and wider society. She has told me patients are actually having to educate their medical professionals on this debilitating illness in order to get help. Another one of my constituents, Cass MacDonald, was a full-time NHS nurse who contracted COVID-19 while working in an out-of-office nursing role in Edinburgh. Despite having multiple underlying health conditions and being told to shield by the Scottish Government's advice, the same government still advised it was safe for NHS staff to come to work. Cass has been living with long COVID ever since and is unable to go back to full-time work. Since COVID special leave has ended, Cass is now on a standard sick pay, which has been halved this month and will be stopped altogether in September. Cass has also been told, due to their financial circumstance, their only option is to declare themselves bankrupt or sell their home. The Key Worker Petition UK team's recently survey showed that Cass is part of the 20% of key workers in the UK with long COVID who said they were at risk of losing their home due to financial circumstance. Like many others, Cass has experienced frustration within the health service due to lack of awareness surrounding the health impacts of long COVID. Tomorrow, Cass and other key workers will deliver a petition in London urging the UK government to create a pension and compensation scheme for all key workers who have developed long COVID as a result of their frontline work during the pandemic. This petition already has over 118,000 backers. The Scottish Government must be part of the process to help stop the stigma around the long COVID. It must do more to ensure adequate support for key workers who are desperately struggling due to long COVID. It must do more to increase public awareness of the danger of long COVID and help people like Cass, Marie-Claire and other thousands of others suffering from long COVID across Scotland. And again, I thank my colleague Jackie Bailey for bringing this to the Chamber. Thank you.